Hello, my name is Eileen Whelan and I'm the HSE lead for the Test, Trace and Vaccination Programme COVID-19. The COVID-19 vaccination programme is the largest public vaccination programme rolled out in the history of the Irish state. 97% of our population over the age of 18 have completed their primary vaccination. Overall, the programme has delivered 8 million primary vaccines and 4 million booster vaccines from the 28th of December 2020 up to the 1st of November this year, 2022. We've had the second highest uptake in the EU for primary vaccination, and we're in the top 5 countries or higher in relation to the uptake of booster 1 and booster 2 vaccination, and booster 3 vaccination has just commenced since the 3rd of October this year. Delivering a programme of work of this magnitude required the development of a programme management infrastructure. This included building governance structures, including clinical governance, the development of human resource workforce planning, the employment of additional staff, the redeployment of some staff, and the education and training of staff in specific areas. The building of our ICT infrastructure was core to success, and the establishment of a financial management programme, a very engaging communications programme, and ensuring good operational management on a day-to-day basis were key to success of the programme. Administering the vaccine programme was based on a population health approach, ensuring that there was access for the people most vulnerable in the early stages of the vaccine programme. This was critically important as there was scarcity of vaccine at the outset. COVID-19 posed a serious threat, particularly to persons over the ages of 65 and people with underlying medical conditions. People who acquired COVID were at a risk of attendance in hospital, potential hospital admission, ICU admission, but increased morbidity and mortality also. Inclusive of building on population immunity, additional measures were recommended that were mandated at different points to protect our population. This included encouraging social distancing, mask wearing, washing of hands, and good cough etiquette, overall enhancing infection prevention and control practices. Lockdown of society was introduced at varying points in time where concern was increased, and the concern related to regarding the capacity of our critical care and our hospital capacities to cope. The national impact of the vaccine rollout was essential. It ensured improvements in population immunity against COVID-19, and it protected both individuals and society. It enabled our health system to function, albeit there were times when there was pressure within the health service. And it allowed the Irish economy to reopen and society to return to normal. It was important that sufficient numbers within our population were vaccinated before the restrictions could be eased. The benefits of the ICT that was implemented and were put in place during the vaccination programme was essential in capturing information and collating and giving an accurate picture of the country's vaccination levels at any point in time. As I mentioned, this was the first time a vaccination programme of this size was rolled out in Ireland. It required the development of a significantly new ICT infrastructure to process and manage the information. The HSE developed digital dashboards which pulled information from all vaccine centres into a centralised filing system. This information included demographic data and status update in relation to individuals' vaccination status. The HSE was able to display this information on dashboards and feed the results back to the government, who could make strategic decisions based on up-to-date data and future projections. This type of digital development was essential in the planning and rollout of vaccine at various different phases and understanding the level of immunity within the population at any time. The learning from the vaccination programme has been huge. The ICT development has huge potential to support vaccination and other health programmes in the future. The HSE is delighted to have been shortlisted for the Greatest National Impact Project category at this year's Ireland chapter of Project Management Institute PMI Awards. It is an honour that we have submitted this project on behalf of all of the staff in the HSE. Thank you for this opportunity, and Gurv Mila Mahagat.